After the treatment, you can put a hydrating mask on your client's face. Here I am using a sheet mask which is soaked in the serum of hyaluronic acid. Other masks which can be used after this treatment are creamy masks, gel masks, which can be hydrating, calming, or cooling the skin. If you are using the same mask as in the video, make sure that there are no bubbles between the skin and the mask for the maximum absorption and results. You will leave such mask for around 10 to 15 minutes or longer, after which you will remove the sheet. Other masks must be used by the instructions of the manufacturer. Some they will need to be left for 10 minutes and some might be left even for 30 minutes. A sheet mask will be the easiest to use and to remove, and it will save you time. However, the creamy or gel masks will take more time to remove, so you have to take this into consideration when planning on the duration of the treatment. Avoid mud masks after this treatment, as the skin might be too sensitive for such type of a mask. For the eye area, you can use 2 cotton pads soaked in rose water, and for the lips, a special lip mask or lip moisturizer. In case you have treated the neck area, the mask is applied there as well. Finalizing the treatment. We will remove the face mask and we will proceed with the serums and creams. Here we have a sheet mask and there is a little bit of the serum residue left from it. So I am just wiping it off and I am wiping those injection points as well in case there is a little bit of blood left. And then as we need a dry surface in order to apply the serums and creams, I will simply pat dry the surface with a napkin. Paper napkin will be enough here. You can also use a cotton towel. After our skin surface is dry, we can start applying the serums. You can use various serums such as hydrating or brightening, and here I'm using a serum for the eye area. I'm gently rubbing it in around the eyes. You can use simple rubbing movements or you can use circular motions. Furthermore, I will use the facial serum. You can use a moisturizing serum, brightening one. You will choose it according to your client's skin type. If you see any pigmentation on the face, you can use a brightening one with vitamin C. If you feel that the skin is dry, you can use one which is hydrating, moisturizing with, for example, hyaluronic acid. Or if the skin got very red and you see that it's sensitive, use a soothing or calming serum. After the serum is applied and it's soaked into the skin well, we will use a cream, facial cream. Again, choose a cream according to your client's skin type, or you can use a universal cream, facial day cream, for example. If it's a daytime and it's a sunny day, especially, don't forget to apply the SPF sun protection on top of the face cream. Some day creams will already include the sun protection, the SPF sunscreen, which is really convenient. Like this, you don't have to apply a ton of creams on the skin. SPF means sun protection factor, and number 50 would be the best to use just after the treatment, as the skin is still a bit sensitive. Here I am just soaking in some residue from the facial cream. And to finalize the treatment, you can also apply a moisturizing lip balm. In the end of the treatment, you can advise your client on the aftercare, which is not to go directly to suntan, as the skin is still sensitive, and she in general should avoid the sun for at least 1 week, and the best would be for 2 weeks. If during these 2 weeks she has to go outside, she should wear an SPF of at least 30. Here, as you can see, I am applying the lip balm. I picked it up with a Q-tip. Like this, I will throw the Q-tip immediately after the use. And now we will zoom in a little bit to see the skin surface. You have to tell your client that little injection dots and some redness will be visible for a couple of days.